Hi everyone and welcome to our Michigan Medicine live event. I'm Ed Bottomley with the Michigan Medicine Department of Communication. June is National Safety Month and today, the first day of summer, meaning people are getting outside, enjoying the weather and all the activities the season has to offer. But with these outdoor activities comes the risk of serious injury. Today we have two emergency medicine experts with us to explain some of the injuries that can occur, as well as offering you some easy to follow tips to keep your family safe all summer long. So let's jump right in and meet our panelists. Next to me, first up, is Dr. Brad Uren from our Michigan Medicine Department of Emergency Medicine. And on the far side, we have Marie Snodgrass from the Pediatric Trauma Injury Prevention Team at CS Mott Children's Hospital. So thank you both for being here. Just a reminder for our viewers, you can submit questions at any time, even now, for our panelists to answer during today's chat. Questions can be submitted by commenting on this video, but please note that your name or your profile name will be visible to others participating. Now, if you prefer a more anonymous option, you can also send a private message to us via our social media pages. If you can't stay for the whole chat or want to share the recording with a friend, a video of this chat in its entirety will be up on our Facebook, Twitter and YouTube accounts for sharing too. So let's kick things off with our first question. Mowing the grass. Mowing the grass is a common thing to do in the summer, so what are a few safety tips to keep in mind?
So I'd like to point out to people that it's a pretty mundane task. It's something everybody has to do in the summer, but it actually can be pretty dangerous. We've seen people with injuries all the time coming into the emergency department, injuries to hands, to feet. And so the first thing people can do is just be prepared. Read the manual, understand what you're doing. Be ready, clear the space so you're not likely to kick up debris that you could throw and hit yourself in the eye. And just dress the part. So make sure that you're wearing proper footwear, proper clothing to protect yourself from any flying debris.
Thank you for that. Are there any other issues with regards to lawnmower safety that you've seen?
We like to point out that lawnmowers are not toys, that they're really can be very dangerous pieces of machinery. And so we want to make sure that people understand that children under 12 years old shouldn't be operating push mowers. Children under 16 shouldn't be operating rider lawnmowers. We never should be riding with a child or another passenger on a riding lawnmower. We should always make sure that that kids are clear of the space when we're outside mowing the lawn. So we want to make sure that children aren't outdoors when we're mowing the lawn, that we're keeping kids clear of the area when we're outdoors. So we want to really make sure that kids aren't around and that we're keeping that area clear of them, and that they understand that they're not toys, that they're not playing on them when they're not being used to mow the lawn.
Sure, and I imagine playing on them when they're not used to mow kind of encourages them to be around and playing when they are used to mow.
Right.
What about the topic of stored energy? Being aware of the stored energy.
So I've seen a number of hand injuries that have resulted from that when the lawnmower becomes wedged. It suddenly hits something and that blade that's spinning at a very high rate of speed suddenly stops. And I tell people, resist the temptation to reach in there with your hand and try to move it, because if you remove that obstruction, there still may be stored energy that causes that blade to move at a high rate of speed and could cause injury. So if you're going to remove that obstruction, use something, a stick, something that you can keep at a safe distance in case that blade starts to spin again. Because you never want to put your fingers anywhere near anything that could move.
I imagine a danger too when you're talking about something that's a mundane and quite a regular task. I think we all know the undulations of our lawns. I know where a few rocks are. I know we've got this one stump that I can kind of go near. Mm-hmm. If I'm in a hurry, I'm probably not treating it as I should. So that's a very good point about that stored energy. Now, how can adults keep children safe around lawnmowers?
I think, again, just to reiterate, making sure that I personally recommend keeping them indoors, not having them outdoors when you're mowing the lawn. But again, not having them anywhere around the machines, not having them on the riding lawnmowers. Again, can't stress that enough, that they're not toys. They shouldn't be riding with anybody when they're mowing the lawn. And just keeping them away from that whole task is what we would recommend.
Sure, yeah. So no playing, no riding along.
Correct.
What could you reiterate the age recommendations again?
Sure. The recommendations are 12 years old to operate a push mower and 16 years old to operate a riding lawnmower.
Okay. And so now, I think a natural segue here, we're talking about ride-on lawnmowers. What about ATVs? What would be your advice for those?
ATVs and ORVs are a tricky subject because there's a lot of laws and recommendations around ATVs and ORVs. I think the key takeaways that I would want people to understand is that there always needs to be adult supervision when we're talking about children riding anything like this, but they're not toys. I think that's a little bit of a misnomer. I think we need to understand that they are really dangerous pieces of machinery as well. There are classes that kids should be taking. If they're under 16 and they're riding on anything, an ATV or an ORV, they should be licensed, they should be certified, and they should be carrying their license with them at all times. Anybody who operates an ATV or an ORV needs to be helmeted, needs to be wearing proper eye protection, needs to be wearing proper protection on their body as well, so long pants, long shirts, things like that. But again, they're not for small children to be riding on by themselves unsupervised. There are strict laws about where they can ride, if it's a private land versus public land, and they would get all this information through a course, a certification course. But again, riders under 16 have to take this course, and they have to be certified and carry that certification with them at all times when they're riding.
Sure, that makes complete sense. And I think, today is the perfect time for this Facebook Live. It's wonderful weather outside.
Absolutely.
People are going to be looking to go outside.
Yeah.
National Safety Month as well. So we're going to be going all over the map with safety topics. And our next one, the 4th of July, is less than a couple of weeks away. What can people do to stay safe around fireworks this summer?
That's a great topic, and we're already starting to see, unfortunately, some injuries related to fireworks in the emergency department. Fireworks also, they can be a lot of fun to watch, but they also carry some risk, and understanding how to use them safely can help you avoid that risk. And so starting with making sure that you have a clear lighting area so that the people around you, your neighbors, the people that might be watching, know that you're going to be setting off those fireworks and so that they're safe, so that there's a safe distance. Understand what those fireworks will do. Do they shoot in the air? How far do they shoot in the air? You need to understand those things so that you know how big of a space that you have to prepare. Never, ever relight a firework that doesn't go off. Don't try to relight a dud. We've seen many injuries resulting in that. We've also had injuries where people will go up to a firework and try to push it or knock it over, only to have it go off and result in injury. So really, if it doesn't go off, leave it alone. Let it sit for a period of time, and then hit it with a hose, drown it in water, and just leave it be. Don't try to set it off again.
Being an Englishman, our big time for fireworks is the 5th of November, and I always remember the advice, because it's a little bit nippy in November in England, is, watch out for your hoods. Watch out, for your coats and things like that, because debris could fall back there and things like that. And then can we touch on what we talked about before we went live? The idea that, people need to know about these risks because they're not necessarily aware of them. And these are things that you guys have seen. Mm-hmm. You're speaking from experience here and sharing it so that people can be aware and make those informed choices.
Right. And I think something else to touch on, I think that sparklers are something that comes up a lot around the 4th of July. And I think parents often think that it's a safe option, and we think that that's a safer option to give children, as far as maybe I wouldn't let them light a firecracker, but I'll hand them a sparkler, not thinking that a sparkler is going to heat up to 1,200 degrees also, and we're putting this in small hands. And so we recommend things like glow sticks and things like that, that can be fun for kids, small children, that might be a safer option than sparklers and things like that. So yeah, just trying to give other safer alternatives to small children and that can also be fun, but not as dangerous, because unfortunately we have seen a lot of really horrible accidents, and we'd prefer not to see any more this year if possible.
Absolutely, and I'll add to that, as someone that grew up playing with sparklers as a kid, we all have this idea that it's safe, but I can still remember being hit by those very hot, sparks sometimes that can burn, and I've seen some bad burns associated with this, and so my kids get glow sticks.
Sure. And while we're on the topic, the next question is, how common are these firework injuries?
I will say that we see them this time of year. We've already started to see some in the emergency department. Unfortunately, we see them every year. I look forward to a 4th of July that we can go through that whole fireworks season and not see any, but we're still seeing a few every day. Face, burns, injuries to the face, injuries to the eyes, and injuries to the hands. Those are the things where they've gone off while trying to light, or they've actually fired into somebody's face and caused burns or injuries to the face or the eyes.
And that kind of nicely goes into our next question. What do firework injuries look like, and how severe can they be?
There can be a variety of them. Like I said, the extremities are usually the things that are sort of closest to the fireworks while people are setting them off, are the first things to be injured, but also to the face. They can be very severe. I've seen people lose eyes. I'm aware of people that have lost their lives actually being hit by large exploding fireworks. So they're, and especially as we move into the season, we see people that will go out and invest in really big displays, really powerful displays, and it's important to keep in mind that the stuff that's available for consumers is usually of a certain size that's powered to perhaps be used more safely in a backyard environment, for example. But what you've seen, you can see some really powerful ones wrapped in plain brown paper, and that indicates it's either homemade, which is probably not a good idea, or it's actually intended for a professional display, and that's something you probably don't want to be setting off in your backyard.
Thank you for that. So the next topic we're going to head over to is water safety, another very timely topic. Is it true you have to wait 45 minutes after eating to swim? That's our first question.
No. The short answer is no. There were some well-intentioned ideas years ago that brought that up, but really, as long as you're feeling okay, you're not too tired, you're not having belly pain or anything that would distract you, you can go in the water after eating.
Okay, great. And our next question: how can people stay vigilant for signs of drowning?
I think having, keeping an eye out, using a buddy system, just watching for drowning. I think a lot of people have the idea from the movies or from TV that, people will be yelling and splashing and saying, "Help me." In fact, that's not often what happens. People may just simply slip below the surface. And so just watching carefully is really important.
Yeah, and we can't stress enough that adult supervision is key when it comes to children around water, whether it be a backyard pool, whether it be a pond, a lake, anything. And we actually recommend making sure that somebody is identified as that person who is the identified supervisor maybe, or whoever's going to be the one watching. We recommend something. We have these little water watcher tags that we give out at events, but you can create your own, something that kind of identifies who the adult is that's kind of in charge and who's watching. And that way, if I have to go in, I'm going to hand it to Brad and say, "Okay, I'm going inside to use the restroom or to get some food. And now you're in charge. You're watching the kids now." And just because a lot of times at like a family event or a big gathering, there's so many people around that we kind of assume somebody else is watching our kids, and they can easily kind of be lost in the event, and we forget sometimes to keep a close eye on them, and you would not necessarily know that something is happening or somebody's in distress. So that's one of the things that we really try to stress is just keeping adult supervision and making sure that we've got eyes on the kids at all times.
Sure, thank you. That's a fantastic thing there. How about some basic swimming safety facts? Talk about life jackets, diving areas, buddy system. I know we already did that, but can we touch on some of those?
I think it's important to make sure, take the opportunity to teach your children how to swim. If they're going to be around water, if you live near a lake or you vacation near water, they're naturally going to be drawn to that water. And so making sure they know how to swim, teaching them yourself, putting them in a class if that's what it takes. Make sure they have the appropriate, swimming safety gears. And the little floaties on the arms are not necessarily the appropriate. A life jacket or something that is actually approved for life safety is what you want to have that child in if they're around water and they don't know how to swim.
Thank you for that.
And also to kind of piggyback on that, if you have a pool and your child knows how to swim in a pool and you go to visit a lake or an ocean or something like that, you have to understand that there's going to be a big difference with currents and different things like that. So to understand that not all water is the same, and understanding that the depth of water can be different. So if you're out on a boat, just to jump off or dive off of a boat not knowing what the depth of the water could be is a very dangerous thing to do. So we don't recommend diving off the back of a boat when you don't understand what the depth would be, because we don't want to have any, serious injuries by diving in and hitting, head or, spinal cord injuries, things like that. So we want to make sure that parents understand and caregivers understand the differences between, the pools and larger bodies of water and things like that.
Absolutely, absolutely. The next question we have is with regards to dry drowning. Is dry drowning a real risk?
So the answer. So this creates a lot of anxiety every year, and I see lots of discussion about this on social media. I think it's important with what we do to raise awareness without creating any kind of panic. And so I think the most important take home from all of this discussion of dry drowning is that the likelihood that your child or someone else will go underwater, come out and have no symptoms, only subsequently to die suddenly, is extremely unlikely. When we're talking about drowning, that's basically getting fluid into your lungs that should be causing difficulty breathing right away. It should be apparent that person is in distress. They're coughing, they're sputtering, they're having difficulty breathing, and you should get them to medical attention right away. But the idea that there will be this delay with sudden decompensation of that individual is just not something that is medically seen. And I would stress that if anyone has concerns about a loved one or someone that they see after an event where they've gone underwater, certainly bring them to medical attention. I'm not suggesting that they shouldn't, but I want people to feel more at ease and less anxious about the idea of dry drowning because it just doesn't happen as some of the social media stories have led people to believe.
Indeed. And so that's the next question. Why is this something that resurfaces every summer if it's not real? I'm assuming social media might be part of that.
I think that may be part of it. I think it speaks to our anxieties. There's probably an evolutionary benefit to us hearing about stories where people were injured and how to avoid those injuries, and I think that's part of what you hear with this coming up year after year. But it's still not something that I think people need to lose any sleep over. They just need to watch their children, watch the people that they're swimming with, and if they look ill to them, get medical attention.
Sure. Next topic is boating safety. What are safety tips people can utilize when they go boating?
Go ahead. No, go ahead.
So I think there's a lot of things that people can do. I mean, just being prepared. That's one of the things that I say time and time again doing this sort of work is that just planning ahead, having knowing your equipment, knowing your boat, what its capabilities are, where you're going. Make sure that you have the ability to safely maneuver, whether that's you have enough fuel, you have emergency oars, you have some signaling devices, a phone or a radio, some means of communicating, and then make sure that someone on land knows where you're going and when to expect you back, so that you know that, and have maps for the area if you're boating in a place that's unusual. And all of these things, they seem like very basic steps, but we see people getting into trouble occasionally when they think, I'm just going out for a 3-hour tour, if you will, and getting into trouble.
Absolutely.
Making sure you have life jackets for everybody on the boat, and there shouldn't be anybody on the boat that's too small for a life jacket. So really, like infants and small babies, it's not recommended that you take small babies or infants, newborns on boats. Anybody that's on a boat should be able to fit into a life jacket, and you should have appropriate life jackets for whoever's on a boat. So can't stress that enough.
And then you touched on this before, but I think it's worth touching on again, the idea of look before you leap. If you are jumping off a boat, be aware of what's around you.
And there's jumping and there's diving, and I think that to jump in water is one thing, but to dive in head first, is what we worry about. Head injuries and the neck and spinal cord injuries are, we know of some pretty horrific, pretty catastrophic injuries actually that have happened from people diving into too shallow water. So if you jump in and it's one thing if your feet hit the bottom, but if you hit with your head, that could be pretty horrific. So absolutely I would never recommend diving in off of a boat when you don't know what the depth of the water is around you.
Very important. And this is another one that you've touched on again, but let's touch on it again. How important is it to wear a life jacket, and what are the ideal life jacket rules for children and adults?
I would say it's extremely important if you're out on a boat, or if you're out in water in any way, and especially if you have any concern about somebody's ability to swim. I would recommend having appropriate life jackets or protective gear on. And we're talking about life jackets, not like we were speaking of earlier, like water aids or swimming aids like water wings or a pool noodle or flotation, just like something that you float on, an inflatable inner tube, things like that. That's not what we're speaking of. We're speaking of actually life jackets that connect and are certified, that actually stay attached to the child. So I would say it's extremely important, and that they fit properly, that they have weight requirements, and so that you don't just want to throw any life jacket on anyone. You want to make sure they're actually like rated for the person that's wearing them. So I would make sure that you've got the right equipment and the right gear before you go out on the boat for the people that are going to be on that boat.
And I would agree. It's absolutely critical to have a life jacket. And I've been involved in a number of cases where people weren't wearing life jackets. They never expected to end up in the water, but they collided with an underwater obstruction. They ran into another boat. Somebody in the back suddenly had a medical emergency, and the whole boat tipped over. And so there's any number of reasons why you may not be expecting to go in the water, and suddenly you're in the water. And so having that jacket on to begin with is absolutely critical to saving your life.
Excellent, thank you for that. And in terms of the next question, how are survival skills important to boating safety?
Well, I think having the right equipment on board that boat, so wearing your life jacket at all times while you're out there, but also having some safety equipment with you, knowing the water temperature and where you are, how far from land you are. Being in very cold water at the beginning or end of the season would require different clothing, and so planning ahead for that, and then having a means to signal, a whistle, a light, something else, so that if you do go out of that water, and hopefully people come looking for you, you have some additional way to signal to them. So it's absolutely critical to have all those survival skills and that knowledge that goes along with where you are, when you're there, that fits all the circumstances.
Thank you for that. Our next question from a Facebook viewer. When talking about drowning, do we still have to ask parent permission to perform CPR?
Not sure I understand the question. I think if I were to encounter a patient that had no pulse and required CPR, I would begin treating that patient immediately under the presumption that patient, that any reasonable person would want that patient to have the best chance to survive. And so I would begin CPR without question.
And we can, if there's clarification, we can go back to that question later. Let's move on to sun exposure and heat rash. First question, how often should people apply sunscreen while outside? While on the water or while going into the water?
I believe that most sunscreen actually will actually tell you on the product itself, but usually it's every 2 to 4 hours. I think that, and it'll depend on how active you are. If you're in the water, if you're very active and you're sweating, they'll have you apply it more frequently. I don't think you can apply it too much. So I think if in doubt, I would recommend putting more on, because sunburn is not good. It's not fun, especially in small children. So we want to make sure that we're being generous with application. And so I would recommend and covering. I mean, there's long sleeved, for swimsuits. There's the rash guard and long sleeve shirts that you can have on. There's hats. There's different ways that we can protect kids too, beyond just spraying them or applying lotions. But I would definitely recommend applying generously and frequently when you're out, not just a one and done, in the beginning of the day, and then assuming it's going to last the entire day for sure. I would reapply frequently.
Yeah, and I've definitely seen people who have been out all day, they applied in the morning, and then between sweating or being in the water, that protection is worn off, and they've come in with pretty severe burns. So yeah, apply often, check the label if it says that you should reapply after being in the water after a certain period of time. Definitely use it more often.
Thank you for that.
Yeah.
Let's talk about hydration. How can people stay hydrated effectively?
Water is your friend, particularly in the hot summer. And so I tell people, if they're going to be outside, they're sweating, they're doing activities, making sure that they're paying attention to that sense of thirst. I mean, we're designed with that sensation of thirst that helps us understand that we need more hydration. So making sure that you've planned ahead, you've got water. Water is fine. It doesn't have to be a more expensive sports drink. If you like them, more power to you, but
Sure.
the water works just fine. But it's also important to think that, that at the extremes of age or certain medical conditions, it may be harder for people to drink lots of fluid or stay well hydrated, and so making sure that we're protecting people at those extremes or that can't drink a lot of water due to other medical conditions, they just need to be protected. They need to stay in the shade, take frequent breaks, or just stay in the air condition.
Yeah, sounds good to me, actually. And how serious of a problem is dehydration in the summer months?
We see a lot of that, particularly as people start engaging in more outdoor activities. Even on a day like today, people working outside all day, it doesn't seem that warm perhaps, but it's sunny and it's easy to work up a sweat and start becoming dehydrated. And particularly people with certain medical conditions can be very sensitive to that. So high blood pressure, they're taking medications like diuretics to help them get rid of water, can actually become dehydrated much more quickly.
Sure.
And so we'll see several people, even on a day like today, in many times coming in.
Go ahead.
I like to recommend too, like if you know you're going to be active, like if you know that tomorrow you're going to a theme park or you're going to be at a sporting event, like building up to, like don't just wait and drink during that event, but be drinking prior to the event. Drink water and build yourself up for that, because we see a lot of kids at sporting events that think that during the game, if I just drink during this game, but that are kind of leading up to the game maybe didn't have enough to drink, so can get very dehydrated quickly during an event, an outdoor sporting event, in the soccer, lacrosse, things like that.
Sure, yeah.
So trying to kind of build up and make sure you're preparing for whatever the activity is that you're about to do.
Yeah, sure, definitely. Let's switch back to sunscreens for a second. The difference between SPFs on sunscreens and how to choose the best for your child, for your family.
I think we might be able to find you a better resource to answer that
Yeah.
question in
Yeah.
a little bit. But I think generally, higher SPFs are better. The higher the level of protection you can get to protect your skin, that's I think what's
Absolutely.
best. And we can see if there's any more clarification that we can get.
And we can look into, if you look at the comments section after today's chat, we're going to be linking to quite a few blogs that we've written in the past. Let's talk about heat exhaustion and heat stroke. What are some signs and symptoms of those things?
So with heat exhaustion, you typically will see somebody. They'll start to show signs of more fatigue, being very tired. Their skin might become red or flushed, and they'll look hot and they'll look uncomfortable. Heat stroke is typically differentiated by someone actually beginning to act very differently. Hence the word stroke. They may be slurring their speech. They may look as though they're intoxicated even, and so that represents an even more serious condition where the body temperature has gotten so high that they're not able to regulate effectively. Both of those. Don't wait for heat stroke. Don't wait for people to
Sure.
become confused. If someone looks like they're having difficulty, that's the time to get them into a cooler environment and get them hydrated, or even seek medical attention if necessary. And there's this sort of myth that perpetuates out there that you'll see someone stop sweating. They may still be sweating and they may still be suffering from the effects of heat exhaustion or heat stroke. So don't wait for that. If they don't look right to you, get them into a cooler environment and maybe even call for medical assistance.
Thank you for that. I think this goes in perfectly when we're talking about heat. Let's talk about the heat inside a hot car. How dangerous is it for kids to play in a hot car, and what happens if a child is left inside a hot car?
So this is a big concern for us. We see nationally, luckily none in Michigan in the past few years, but we see nationally too many children left in hot cars each year and die as a result of that. And cars heat up very fast, even in a day like today when it's not extremely hot outside, but it's sunny. A car, even with cracked windows, can heat up very fast. So we never recommend leaving a child in a car, even with the windows cracked, even with the air conditioning on. We just don't recommend ever leaving a child in a car unattended. So we can't stress enough to caregivers to make sure that keys are put away, that they're not left where a child can get at the keys, that doors are left locked to cars so that kids can't play hide and seek or can't get back into a car if they think they've left something in a vehicle, to go back to a car, because sometimes we have child locks on cars, and so a kid can get back into a car, but then once they get into the vehicle, can't get out, and if an adult doesn't know that can be very problematic. They can get trapped in a car. So unintentionally, children can be left in cars. We also know about situations where caregivers have accidentally left children in cars just on a morning routine driving to work. It seems unfathomable, and I've talked to enough parents and caregivers that we just can't understand it, but it has happened enough, and we know that it happens, that somebody is outside of a routine that they normally are in, and they just get into automatic mode and drive to work and forget, because there's a sleepy baby in the back seat, that I'm not used to dropping off at daycare, and I have forgotten that child in the back seat of my car and have gone to work and left that baby in the back seat of my car because I'm not used to dropping off at daycare. It's not part of my routine. So we recommend leaving something of yours in the back seat so that you have a reminder, doing something like that, because we just don't want there to be any more of these accidents. And there are things that we can do to prevent them. Cars heat up very fast. And so we want to do everything we can to prevent this from happening. And these are just some little kind of tips and things that we can do to try to help parents and caregivers that are very tired and very exhausted at times. We've all been there as parents, and just kind of help kind of come up with some ideas for maybe preventing in the future that any more of these accidents or tragedies.
Sure, thank you for that. Let's move to helmet safety. First question on that topic: why should children wear helmets when they ride a bike, a skateboard, or a scooter?
They only have one brain, and we have to protect it. And so you can be the best bike rider, the best scooter rider, the best skateboarder there is, but there can be a crack in the sidewalk, there can be a dog that runs out, there can be all kinds of things that happen, there can be a car on the road that cuts you off. There's a lot of exterior things that can happen and forces that can happen that are out of your control. And it takes a split second for you to be knocked off of your bike, off of your skateboard, off of whatever, and to hit the ground or to hit a vehicle or to hit something else. And so what we stress is that a helmet is a very easy, inexpensive item to help protect that head that we only have one of. And if worn properly, it can protect. It really can do a great job, and we can't stress enough like how important it is for adults and for children. But definitely, as soon as kids are on any kind of riding, anything with wheels, we recommend, as small children on tricycles, we recommend that we start putting them on their heads just so they get used to it, almost like a seatbelt. If you get used to every time you get in the car, you buckle your seatbelt, every time you get on something with wheels, putting a helmet on, it just starts to become habit. And it's an important habit to begin and to have lifelong.
Absolutely. What do you say? Could you speak to what you say to parents and their children to encourage them to promote helmet safety? I guess you've touched on that a little bit already.
Well, the one thing I tell parents a lot, I'll see parents, we'll do some events sometimes at schools where kids will ride their bikes and sometimes parents will ride up with parents. And it's interesting to see the child with a helmet on but the parent not with a helmet on. And so I often talk to parents about the example that they're setting, because kids will often wonder, like, how old do I have to be when I don't have to wear the helmet? And so I use the seatbelt example a lot and say, would you tell them that there's a certain age when they don't have to wear their seatbelt? And parents, well, absolutely not. Seatbelts, we have to wear a seatbelt. And same thing with the helmet. Like, if they see that it's important to you and that you know that your brain is important and your head is important and that you know that it's important to protect, they're going to know that it's important for themselves, and they're going to constantly, wear their helmet.
Sure.
and know to protect. And so I've had some great conversations with parents and given out a lot of adult helmets in the process to kind of help spark that too. So that's one of the things that we try to do. Yeah. Unfortunately, sometimes for us, it's after the fact. It's after we see them come into the hospital. And so we try to do a lot of the events out in the community to try to, prevent that from happening. In
your experience, do you think some people don't realize how important wearing a helmet is?
Oh yeah, unfortunately, yeah. Because I think that we think that we're good at what we do, and that we are in control when we're on that wheeled device and when we're on that bike or on that scooter. And I think that just like we think we're in control when we're behind the wheel of a car, and I think that until something happens and you realize you're not always in control, and something happens to you, when you realize that you don't have that control, it can be a little eye-opening. So yeah, I think it is hard sometimes for to get that message across. But
and I'll be honest, I grew up in a generation where this was not the norm. Wearing a helmet was not something that you saw a lot of kids doing at that point. But we live in that world where we're seeing people on a regular basis that are coming in for those 1 in 1,000 events, and you only have to see a few of those to realize why emergency physicians and nurses and people that work in this space, all of our kids wear helmets, why we wear helmets, why we're crazy about car seats and safety, because we know that they save lives, and we've seen people who've used them, we've seen people who've not used them, and that's the argument that I make. We could spend an hour talking about some of the terrible things that we've seen, but it's just they do protect people, they do save lives, and they're just absolutely important.
Absolutely. Let's talk about hand signals and walking a bike across the sidewalk. Why are these two significant safety tips?
With bicycle safety, I think, especially like in and around a community like Ann Arbor, where there's so many people on bikes, and it's such a great biking community. Actually, there's such a great biking community in Washtenaw County and in Ann Arbor. I think that it's really important to be able to communicate with drivers, and I think that teaching kids at a young age how to do that and how to let drivers know what your intent is, and I think that as drivers, we can do a better job of paying attention to that. But I think that it's really important to do that. I also think that it is important to teach kids at a young age to walk their bikes across the street. We're doing a lot with our pedestrian safety education to make sure that we're teaching kids when they're either crossing with their bikes or crossing just on foot, to make sure they're making eye contact with the vehicles and making sure that the vehicles see them. So just being more steady on their feet and not riding, so that they can stop faster and they can get back if they need to, if the vehicle is not stopping for them. It just kind of makes them more steady and makes them quicker to respond to what's going on with the vehicles on the road. So we definitely recommend that, and we are teaching that at a lot of our safety towns and a lot of the things that we're doing in and around the community this summer, trying to teach that with our young children. So we definitely recommend parents kind of reinforce that and teach that with their kids as well.
Great. And our final question on this topic: some parents prefer their children ride their bikes in designated bike lanes, but these lanes don't necessarily always ensure rider safety. Do you have any thoughts about riding in the bike lane versus the sidewalk?
I mean, with young children, I'm a proponent of riding on the sidewalk personally, if it's available. If there's a sidewalk available, I would always recommend with children, just because I'm still nervous about drivers on the road. There's a lot of distractions and a lot of things that are keeping our drivers, I think, from giving bicyclists the space that they need and the attention that they need. So if there's a sidewalk, a safe sidewalk that is available, I would recommend with children to keep them on the sidewalks if they're available.
Sure. Let's take a turn towards another topic now. Ticks. How can people prevent getting ticks this summer?
So this is a great example of prevention really being worth a pound of cure. So just not getting a tick bite or not picking up a tick is the most effective way to avoid any kind of tick-borne illness. And so that means being aware of the environment. So like tall grass, brush, things like that those are where ticks like to hide, and you can get them in your backyard, by the way. It's not just out in the woods somewhere. And we are seeing tick-borne illness like Lyme disease in parts of Michigan as well. So it's important to be aware of where those ticks like to live, and then to dress appropriately. So that means trying to cover your legs, not have bare legs, tuck your pant legs into your socks, things to prevent the ticks from getting in there. And then you can also use a bug repellent, something with DEET. The CDC has some great recommendations online that you can look at for how to protect yourself from having ticks get on. Now, if they do get on you, it's important to, when you get home, to do a tick check so that those ticks aren't on you for a period of time, because the longer they're on, the higher the risk of infection. And so, getting undressed, take a shower. It's a great opportunity to look in those spaces where ticks can hide, sort of under the arms, behind the knees, even in the belly button. Ticks can hide too. So, looking for those spots. If you see a tick, remove it carefully, grab it by the head and pull it off slowly. And then try to what I tell people to do is take a picture with their smartphone, because everyone's got one. Take a picture with your phone, and then put that tick in a bag or something else. Throw it away. Don't smush it, but throw it away in a plastic bag, or take a photo of it and make a note of where that was. And if you start to develop symptoms, then you can go and see your doctor and talk about those symptoms, like a rash or a fever. That may happen in several days. But if you know what that tick looked like and where you might have picked it up, you and your doctor can make some decisions about that.
Yeah, I think this is quite an important topic. You mentioned, but let's reiterate, how do you choose the best insect repellent for different occasions?
So there's several different recommendations, and I think we could probably post some links to that later to go through some of the details, because it does vary a little bit by age. But generally, something with DEET, D-E-E-T, is something that you're looking to apply to your clothing while you're out and about in an area where there's ticks. That's probably the most effective thing that you can do. And we can post some additional links with more specific recommendations for very young children as well.
Yeah, young children was going to be my next question too, because when I'm outside, I'm not necessarily rolling about as much as my kids are. So that's always a worry for me. And let's talk about how to remove these ticks.
So if you see a tick, the safest way to remove them is to grab them as close to the skin, as close to the end of their head, with a pair of tweezers, and just pull up slowly to remove that. Usually you can get the tick to come out all in one piece in that event. If it does get stuck, don't worry. Clean the area. If the mouth parts get stuck, just clean it. Soap and water, alcohol, and your body will actually do a pretty good job of removing that little bit that might be stuck there in the skin, but just clean it off very carefully. But try to pull it off slowly. Don't try to burn them off. Don't try to do any of the other techniques that you might have heard years ago. Just try to pull them out slowly with tweezers.
And I believe we have a good blog post on that too, so we can share. The next topic we have is trampoline safety. How should parents go about teaching children trampoline rules?
I'm not real popular when I start talking about this. Really, the safest way to encourage children to play on trampolines, if they're going to be on trampolines, is one at a time. And we would always recommend that they're in a trampoline that is enclosed with the net all the way around it. Again, if they're going to be on a trampoline, my choice would be to not be on a trampoline.
Yeah, let's look into that a little bit more, because I sense that you want to start off with this isn't a really good idea anyway.
I'm not a big fan of trampolines. We've seen a lot of injuries from trampolines, and there are a lot of injuries from trampolines. Kids falling off of trampolines, kids falling on trampolines themselves, and breaking arms and wrists and all kinds of legs, and just getting injured themselves. Colliding with other children is a really common injury. So we see a lot of injuries associated with trampolines.
Sure.
And so adult supervision if they're going to be on a trampoline, and I would highly recommend one child at a time. Again, it's not as fun, I guess, apparently, but it would be the safest way if they're going to be on a trampoline, so that you don't worry about them colliding with somebody else.
Do you have any other trampoline best practices if they have to be on a trampoline?
No other objects or props per se, if you're going to be doing any dance routines or any other like acrobatic type things on the trampoline. I wouldn't recommend taking balls or other toys and objects on the trampoline. And we've sometimes seen that. We've seen skateboards and other interesting things like that. Would highly recommend nothing like that on a trampoline ever. So it's really just meant for one child, and one child jumping alone is really the recommendation.
Okay, the next topic that we have is grilling. How can we be safe while grilling?
So there's a couple of different things that we see with grilling. One is directly related to burns. So people trying to light that old grill that was that's probably one season too old, that doesn't light very well, and people having burns. If that sort of suddenly flares up. So make sure your equipment works is sort of step number one, and take care that you're following instructions so that when you're starting that fire, that it doesn't actually result in any direct injury to you. And the secondary forms of injury that we've seen, and I've seen a few of these, actually is the grill bristle injury. So that's actually, so somebody using, again, an old kind of rusty brush to clean off the grating prior to starting cooking, and then unbeknownst to you, that bristle gets stuck to the bottom of your food, and then you eat it. And I've seen 2 people personally that have had bristles stuck in their throat. It's been described. There's definitely cases that are happening, and people they don't notice when they bite into it, but then they feel it if it gets stuck somewhere. So it is a real thing. So I threw out all my brushes after I saw this happen the first time, and I used sort of the steel wool pad kind of brush to clean my grill.
Excellent. Marie, any tips for keeping kids away
I would
from?
keep kids away from the grilling area, keep them away from the fire and the heat, obviously, because a lot of times, they're right at the same level as they can reach up and grab and be just like a stove, would be dangerous. So we would want to keep them away from that source of heat for sure.
Let's move on to our next topic, which is picnic foods. How are certain picnic foods dangerous?
So you'd be surprised sometimes the reasons people might visit an ER after a picnic. So there's a lot of different things. There's injuries, there's food poisoning, and we'll start with the food poisoning, I suppose,
Sure.
as the first thing. So keeping in mind that you're out of your kitchen, you're not in your normal environment, and so the food preparation you're often taking shortcuts. And so for people to be aware that if you've got chicken that is raw chicken that is being now cross-contaminated, it's on your hands, you haven't washed your hands, you touch something else, and that's getting into the other food. So now you have that risk of salmonella and other foodborne illness that's coming from the raw chicken. You haven't washed the vegetables when you get there, and so you have some other things that come there. And then you have the potato salad and the things that are sitting out in a warmer environment, not refrigerated, kind of sitting there on the table as people go down the line and pick those things up. Those are things that can, after a few minutes, even 45 minutes or so at a higher than average temperature, can start to grow some bacteria. And so then you have people with nausea, vomiting, and diarrhea, usually within a couple of hours after ingesting that. And so we'll see a fair number of people after big picnic events, family reunions. I've seen my share of people coming in with that, and probably the potato salad or something like that. So just taking extra steps to make sure that you've got proper cooling for those foods that need to be kept at certain temperatures, and plan ahead, wash the foods at home, prepare them as best you can so that when you're there to make them on a grill or do whatever else you're doing at your picnic, that you can avoid that cross-contamination, and you've taken those preparatory steps ahead of time so you don't have to try to make do when you don't have the resources.
Sure. I think there's some really important points there. Can we touch on alcoholic beverages, safety in alcohol?
So alcohol has resulted in a fair number of injuries that have brought people to the emergency department overall. I think there's certainly something to be said for enjoying an alcoholic beverage on a nice summer day, and I'm not telling anyone that they can't do that, but simply to be aware that there are risks that come with that. So the more you ingest, the higher the likelihood that you become dehydrated, not to mention the effects that it has on your coordination and your judgment. Sure. And so all the things really we've been talking about become more dangerous with alcohol. So grilling, higher risk of burning, fireworks, boating, riding a bike, all of these trampolines, all of these things become more dangerous when you have some alcohol. And so if you're going to make alcohol part of your celebration, you need to just plan ahead, make sure you're well hydrated, and make sure that you're not then taking part in activities where you could injure yourself or someone else after you've enjoyed a few.
Absolutely. We've touched on a variety of topics. As a dad of 4, I think they've all rung certain bells with me. There's one topic though that I wanted to throw in here, see if you had any opinions on it. It's summertime. People often have fires outdoors. They're cooking s'mores and things like that. Fire safety tips for kids when they're around a fire, a campfire, for instance.
That's a great question. I think that I can't stress enough, and I think this has been a pretty common theme all the way across, is adult supervision, making sure that you have the proper amount of adult supervision if you're going to have kids around a fire. Making sure that your fire is contained, making sure that it's a safe fire. So whether it be in a pit or whether it be in a metal fire
Sure.
pit, I'm not sure what they're called, but something that's going to safely contain it. And then making sure that however, I get nervous around, children actually being the ones that are, doing the marshmallows or whatever it is. So making sure there's an adult kind of there with the child that, so the child isn't the one getting close to the fire and isn't doing, putting their hand close to the fire, because things can spark and things can kind of jump from the fire sometimes. So you never want the child to be the one getting too close to the fire. And I think that anytime that we're doing any of these types of activities with kids, it's really important to always be explaining to them what we're doing with them, to be walking through like why it's okay for you to be doing this with me as mom with you right now, but when mom's not here, this is never anything that I would want you to do without me here, because this could be very dangerous. Because as soon as we walk away, or as soon as we go somewhere else, or they're at somebody else's house, you don't ever want a child to think that they kind of have free reign and can do these things without you present. So I think that and fire is a great example, when you have a fire like that. But I also think it's really important to make sure that fires are completely put out at the end of the event or whatever, to make sure that you safely put the fire out and that you have a way of making sure that's all done. But again, adult supervision, and then I can't stress enough how when we're talking about pedestrian safety, when we're talking about any of the safety topics that we're on, when you're there with your child and you're doing something with your child, to be talking through what it is you're doing with them and explaining what's happening. When you're crossing the street, did you realize we're looking left, we're looking right, and we're looking left again, just to make sure no cars are coming, and just kind of putting into words, because sometimes I think we get busy with kids and we just do for them, or we do things with them and we don't always explain to them what we're doing. So then we're not giving them the tools for when it's okay for them to do something, how to do that. So I think that as parents and caregivers, we can do a better job of kind of giving them some of those tools and helping them. That's my recommendation.
Sure, thank you. And I think I would echo all of those points. They're great points. And a couple of other things that I would bring up, more for the adult side, but also just thinking of, I've seen lots of people in trying to get a bonfire going. You're trying to do it. It's a beautiful night, and it just rained. The wood is kind of wet, and so the temptation is to go out and get something flammable, some gasoline, some lighter fluid, something to light it, and then I see them in the ER with severe burns. And so just having a different plan. Dry paper, dry kindling. Find some other way to get that fire going. Don't use gasoline or some kind of accelerant like that, because it so often results in burns, and that's something that we don't want our kids to be seeing and getting the idea that that's how you should get a fire going. And one other little point, as someone who does enjoy a bonfire with the kids, that one of the things that we have done in addition to all of those things is just having the ring and the expectation for the kids that if they're going to walk around the fire, they walk behind where everybody is seated, rather than trying to get around people's feet and then fall in the fire. Because having seen those injuries, never want the kids to be that close to the fire. They should always move away as they walk around to see a friend over there.
Excellent advice. Thank you both for that. So we're moving in towards the end of our chat, but I always want to say, first off, is there anything you think we've missed? Is there any advice that you'd like to impart before we end?
I think we've covered a wide variety of topics, and I think the thing that I always feel sort of like the fun police sometimes when I do these talks, and the point of this is not to scare people or to prevent people from having fun, but rather to make sure that people plan ahead, because summer is short enough here in Michigan, and so wasting time in the emergency department with an injury is not what you want to do. I'd rather people be out having fun, not coming to see me, and enjoying their Michigan summer.
Great. Marie?
I echo that. I think that we've covered a lot of things, and there's probably a lot more that we could cover, but yeah, we just want everyone to have a safe, fun summer, and we would love to be bored at work. We would love to be sitting around twiddling our thumbs this summer and not have a lot to do. And so we hope that everybody stays safe. That's our ultimate goal.
Yeah, so thank you both for your time, for your expertise, for helping families get more information about how to stay safe in the summer. Again, to our viewers, if you're interested in sharing this recording, it's going to be on our Facebook page, our YouTube page, our Twitter page as well. So thank you to our viewers for joining us. Thank you to our experts.
Thank you.
And have a wonderful afternoon.